Rolling? Alright, thank you. Alright, I have a few questions to ask you about attention deficit disorder, or ADHD, or attention hybrid disorder. What are some of the common causes for this problem?
Well, there's growing research in that area, and we're learning more all the time about potential causes, but it seems to be multiply determined. So there's no one single cause that we can point to, no one single factor that if a kid has that factor, they're going to develop attention deficit disorder. But it seems to be more of a collection of risk factors. Some of them are biologically based, neurologically based, and others are more based in experiences and environment. So it's likely that children might have a genetic predisposition to have this set of symptoms manifested. But it's really in the context of living in family situations, community situations that might make that genetic vulnerability manifest into the full-blown childhood disorder. Some of the risk factors are having a parent with attention deficit disorder. Therein lies the genetic link, but it's not a perfect link. So there's some parents with pretty solid history of attention deficit disorder whose children don't develop the disorder. And there are other kids who develop the disorder with parents without it. So it's not a perfect genetic link. But if a child has the vulnerability, then things like living in a chaotic family, being raised by parents who may not be able or willing or knowledgeable about how to raise a kid with these kinds of symptoms. So the symptoms then can be exacerbated in those families because the parents aren't sure what to do, or the teachers aren't prepared to work with the kids, in which case the symptoms can kind of worsen over time. So it seems to be a collection of risk factors.
So from what I heard, that according to a recent study, like almost 90 or 60, 70, 80% of people in America have ADD or ADHD or somewhat. Is that true or not?
Yeah, I don't know the exact percentage. There are lots of individuals that probably have some of the symptoms, but not all the people with symptoms are going to be able to be diagnosed with the full-blown disorder. It's definitely the disorder of the day.
Obviously.
It's getting a lot of press, a lot of pop psychology is jumping on this particular disorder. It may be over-diagnosed, but it is it's a real disorder. We're not making it up. It is a collection of symptoms that tends to really impact kids and adults' lives. So there's definitely something to it, but it's probably not as widespread as the media is making it seem.
Are there any type of treatments and like medicine or like anything?
Yeah, there is a collection of medications called psychostimulants that can be effective for kids with attention deficit hyperactivity disorder. It's effective in about 75% of individuals. So there's 25% of kids with the disorder that medication's not going to be effective for. The most effective intervention is a combination of medication to calm down some of the effects, combined with interventions that teach kids strategies for coping with the symptoms. So there's ways to help individuals kind of manage the impulsivity, helping kids to think before they act. Kids with ADHD are sometimes aggressive, so we can do things like anger management and teaching them alternative ways to solve problems rather than striking out. So that set of life skills is really important, and that doesn't come from medication. It comes from intervention.
What do you say is about 25% of treatment are actually done not by medication?
Well, I'm saying 25% of individuals with this disorder will not respond to medication.
How important is that?
But 100% of the kids should get the behavioral interventions because they all have problems with.
How important are you saying this non-pharmaceutical intervention towards the treatment of the ADD, ADHD?
What was the question again?
How important do you say?
Important? I think it's essential.
Okay, essential. What are some of the side effects for this pharmaceutical thing?
Good question, because there are some side effects. It can decrease appetite
Right.
to the point of kids really not being very interested in eating. The side effect of not eating is not growing and
Absolutely.
developing. So some kids that take these medications, if it's not well controlled, can have a little bit of a growth retardation, slowed growth. It can lead to sleeplessness.
Yep.
So there's, it's really important for anybody who's on the medications to have those side effects tracked carefully. And it might be that the medication could be decreased and still be effective, but the side effects would go away. So there's ways to balance that, to get the right dose.
Are there any like visual or audio treatment for ADD, ADHD? And that's essential while we're focused on the project. We're trying to create a visual or audio treatment for people with ADD, ADHD.
Right.
And I have heard studies that audio treatment can be helpful for kids with ADD, ADHD.
Well, there's actually some interventions that use technology to train kids to maintain their focus. I'm not the expert on those. We have a psychoeducational clinic here on the 6th floor. The director is Patsy Collins.
Okay.
And Dr. Collins would really be a great source of information.
Good.
Yeah, she actually uses some of those interventions.
Oh, really?
Yeah, and she's kind of a local expert.
Does that seem really helpful?
Yeah, ask her about something called COGMED, COGMED,
Okay.
and she can explain the technology and how it's used, and she can tell you about the research on it.
Oh, great. Thank you for your time.
Absolutely.
That'll be all. Thank you.
Good luck with the project.
Thank you. So we got a lot of good information out of here.
Good.